I would like to talk about the Code of Ethics for Pharmacists. According to the American Pharmaceutical Association, the first code is a pharmacist should hold the health and safety of patients to be of first consideration. He should render to each patient the full measure of his ability as an essential health practitioner. A pharmacist, number two, a pharmacist should never condone the dispensing, promoting, or distributing of drugs or medical devices or assist therein which are not of good quality, which do not meet standards required by law, or which lack therapeutic value for the patient. Code number 3. A pharmacist should always strive to perfect and enlarge his professional knowledge. He should utilize and make available this knowledge as may be required in accordance with his best professional judgment. Code number 4. A pharmacist has a duty to observe the law, to uphold the dignity and honor of the profession, and to accept its ethical principles. He should not engage in any activity that will bring discredit to the profession, and should expose without fear or favor illegal or unethical conduct in the profession. Code number 5. A pharmacist should seek at all times only fair and reasonable remuneration for his services. He should never agree to or participate in transactions with practitioners of other health professions or any other person under which fees are divided or which may cause financial or other exploitation in connection with the rendering of his professional services. Section 6. A pharmacist should respect the confidential and personal nature of the of his professional record, except where the best interest of the patient requires or the law demands. He should not disclose such information to anyone without proper patient authorization. I will repeat this code because I had a little break. So if we go, a pharmacist should respect the confidential and personal nature of his professional records, except where the best interest of the patient requires or the law demands. He should not disclose such information to anyone without proper patient authorization. And the seventh code is a pharmacist should not agree to practice under terms or conditions which tend to interfere with or impair the proper exercise of his professional judgment and skill, which tend to cause a deterioration of the quality of his service, or which requires him to consent to unethical conduct. Section 8. A pharmacist should not solicit professional practice by means of advertising or by methods inconsistent with his opportunity that advances professional reputation through service to patients and to society. Code number 9. A pharmacist should associate with organizations having for their objective the betterment of the profession of pharmacy. He should contribute of his time and funds to carry on the work of these organizations. These are the codes which pharmacists have to practice or inculcate in their practice to make their profession sanctified. The reference for this is from the Remington's Pharmaceutical. Thank you. Namaskar.